Hi, I'm Kareem Salhia, consultant cardiac surgeon. Many patients with heart disease do worry about the risk of heart surgery. Heart surgery has improved quite significantly over the past years and became one of the safest and most effective operations in improving patient symptoms and long-term survival. The risk of heart surgery depends on many factors, including the nature of the operation that has been undertaken and the patient factors. It is important to assess the risk for each patient individually after a thorough study of the patient's condition and assessing the risk factors. To do that, we also use scoring systems, which is systems based on studying thousands of patients that incorporate all the factors involved in the operation and contribute to adding risks. Such factors include the age of the patient, the presence of other diseases and comorbidities such as diabetes and high blood pressure, the presence of lung disease, kidney disease, problems with the peripheral vessels. Also, the condition of the heart, including the strength of the heart muscle, we call it ejection fraction, and whether the patient had previous heart attacks and the presence of high pulmonary artery blood pressure. Of course, the nature of the operation is important. The operation could be just a simple bypass graft or a valve replacement, and it could be a complex operation involving different things. How urgent the operation also needs to be performed is important. Operation needed to be done urgently or as an emergency are associated with increased risk. Assessing the risk is not simple or straightforward. It requires an experienced surgeon to look into all these details and give as accurate as possible an estimation of the potential risks and complications. But we also remind patients that it's also very important not to compare themselves to other patients, as everyone is unique with his or her condition. How can we improve the outcome from heart surgery and increase the success rate while reducing the potential complications? There are a few factors that are important to improve the outcome from cardiac surgery. The first thing is by making the correct decision for the patient for their best interest, and also not to delaying the proposed operation until complications do occur, such as weakening of the heart muscle. It is important for the patients to choose the right surgeon and the heart team. This team will work in harmony to provide the best care for the patient. They will provide a thorough assessment of the patient before the operation and try to improve the risk factors in order to achieve the long-term outcome. This will include diabetes and controlling high blood pressure as much as possible. The expert team will also look after the patient very well during their stay in the intensive care and the hospital, because also this is one of the crucial times in the journey of the patient throughout heart surgery. The team will also look after the patient on the long term and provide a close follow-up in order to pick up any potential complications or problem that can occur and treat them as soon as possible for the best outcome. Choosing the right hospital is also important, because good hospitals will provide state-of-the-art facilities without compromising on the quality of the care and the surgical instruments that are being used. Studies have shown that patients who undergo cardiac rehabilitation after heart surgery do get better outcome and do feel much better, and this will improve the outcome in the short and long term. Finally, our advice to the patient is that they do have the right to know about their risks and about the potential complications. And rather than worrying about these things, is to look into all these factors that we've just mentioned in order to improve the outcome of heart surgery. Having a positive attitude is very helpful, and we wish everybody health and well-being.